Okay, good morning. I hope everyone can hear me okay. I apologize, I had a little computer issue. Um, well, welcome to our webinar today. We are going to talk about how prescription drugs affect your brain. So I'm Dr. Nguyen. I am the clinical director of Desert Recovery Centers. And I just want to thank everyone for joining us. So today, there's a lot of different drugs out there, and it's hard to kind of cover all of them or to have all the information. But one of the I don't want to say more common, but more available in the sense of prescription drugs, right? Because these are medications or things that are prescribed to adults, children, young adults, or individuals who, have a certain type of surgery, injury. And then, of course, there's prescription medications for depression, anxiety. So today we're going to cover how those prescription drugs, when abused, when individuals become dependent upon them, how they affect your brain. And so these are some common high-risk medications. And so just a few seconds ago, I was discussing about different medications that are prescribed for surgeries, injuries. So those are the opioids, right? And this is for pain relief. A lot of times when people get their teeth pulled, they can be prescribed that, or wisdom teeth, um, any type of maybe denture work, surgeries, of course. The opioids are something that definitely helps with pain relief. However, they do have a high overdose risk. And I'm going to go more in details about that. So prescriptions of the opioids, and I'm sure the opioid epidemic, everybody has heard about it, or have known a family member or a friend or yourself are struggling with that. So in the epidemic, the number is about 130 deaths a day in the United States from overdoses. The physical dependence that can occur, that can develop with opioids is can be as quick as 4 to 8 weeks, right? And so over time now, doctors and prescribers have come to learn and understand that, giving the opiates as a pain relief for surgery, after surgery, post surgery, for chronic or acute injuries or diseases. It can be it can be helpful, but in knowing that, you can develop a dependence within 4 to 8 weeks. And then, of course, stopping the opiate use immediately can also have a lot of severe withdrawal, right? Pain, diarrhea, cramps, anxiety, and intense cravings. Um, and something I always want to talk about with opiates is it is a very common medication. It's used with the younger generation a lot, athletes, because they are prone to injuries, right? And so these are the kind of medications that can be prescribed because of an injury. And then moving on to benzodiazepines, right? It has a sedative component. That's what they're used for, to help with sleep, to help with anxiety. And of course, there is also a severe withdrawal risk as well. And so benzodiazepines are things like Xanax, Ativan, Valium. This is used for, like I said before, anxiety, insomnia, and it also, very similar with opiates, has a very high potential for dependence and tolerance, which can develop within weeks, right? And the withdrawal can also be life-threatening, seizures, severe anxiety, tremors, insomnia. And with these type of medications, the benzos, it can cause a lot of side effects that it can impair attention, coordination, memory, all those different difficult things. And then, of course, the opiates or the benzos, when they're combined with alcohol, it just exacerbates and increases the risk, the overdose risk, of course, right? And so a lot of times when using these medications, that there's the pros to them, right? To help with sleep or anxiety, but there's also many cons. Another common high risk medication is the stimulants. This increases dopamine, right? Really gives you that energy, makes individuals have more focus, And these are things like Adderall, Ritalin, Concerta. So it's for ADHD, narcolepsy, and of course, you can see there's a lot of high misuse potential. And this is because, the nature of that medication, it is a stimulant. It makes you feel like you can be awake for hours and days and more focused, right? That is why it can be so commonly misused, and individuals become dependent on that. It can be safe when it's monitored, right? But recreational and abuse, that's where the problems start. And then, of course, when you're misusing or abusing the stimulants, it can cause insomnia, anxiety, increased heart rate, hypertension, so many different mean things because when you're not using it as prescribed, right? And so today we're really talking about there's medications that can be prescribed for a certain time, but when it starts moving into abuse, when it starts moving into a dependence. So it's just very, it's unfortunate, right? Because these are common medications that can be prescribed. Going back to opiates, I just want to talk about 3 to 19% of prescription users develop addiction, right? And then, of course, with opiates, they're very expensive, and then it's easier to transition to heroin. The chronic misuse of stimulants can cause and a lot of people have had family or friends or individuals they know, it can cause not only the insomnia, right, the anxiety, but then that becomes mood swings. That can become psychosis. That can become just a lot more issues that come with not sleeping, the chronic anxiety from the medication that causes. And so these are the high risk medications that we're going to kind of talk about and how they affect our brain. Okay. I kind of touched on this a little bit, but of course, the prescription drugs, they alter the brain chemistry, right? There's a change. There's a reason why these drugs are prescribed because they're to help with focus, to help with energy, to help with pain. So there's different parts of the brain that are going to be activated because of it. And they target neurotransmitters that control our mood, pain, focus, sleep, and stress, as it says. And so when it's used effectively and used within the scope of the prescription, um, it can be very helpful. But what we're talking about is that when your brain, let's just say, becomes addicted to it, right? And when your body needs that, when you're now having a tolerance and you're starting to take more, right? The depressants, they slow down the brain, the stimulants speed up the brain, and the opioids block the brain trigger. And so often, if we're experiencing depression, anxiety, if we're having a lot of difficulty with focusing, we'll try that, right? We want the depressants to help, the stimulants to help, the opioids. But when we become dependent on it, and becoming to abuse it, how will that affect your brain negatively, right? Because you can see here that it can be helpful, right? It can help with your mood. It can help with the pain, help you focus. And so we really want to target when it changes over, passes over that threshold to becoming a danger. And so the dopamine and reward system, and earlier when I talked about how the medications can really, they increase dopamine in your brain. There's a lot of natural ways to increase dopamine, right? We always feel good after we work out, or feel good after, anything that kind of stimulates the body. It releases dopamine, but a lot of these prescriptions, they spike the dopamine quickly, right? And we get used to that. It makes us feel more pleasure. We have more motivation to do things. And really, when you're taking the medication, taking the prescribed drug, you're reinforced every time because every time you take it, there is that time where you feel better, right? But when it goes into being misused, when it goes into being abused, it does reduce your natural dopamine. It reduces you become more tolerant of it, and that's why you have to increase your use over time, right? And then your body is now acclimated to these higher doses and also have the dopamine, and then you have cravings, right? Cravings of I need that, right? And this is so important is that the brain starts needing the drug to feel normal. And so it is pretty scary in that when our the young athletes are the younger generation when they have injuries is that they're being given something by the medical field that's saying, hey, it's going to help them with the pain. But you can see that earlier when I said within 4 to 8 weeks, you can develop a dependence, right? So it really has to be monitored and controlled and then also titrated off of it because of how addictive it can be and how quickly our body can become, you know, very much dependent upon it. And so, how our body becomes dependent, how we build that tolerance is with repeated overuse and continually using our brain adapts, our receptors weaken, and then higher doses are needed, right? And then, if the brain is so used to it, if your body has it will have a physiological response to not having the medication. And so in that case, when you start having the pain, the abdominal cramping, feeling tired, feeling just you're just a reaction to it, of course, you're going to say, how do I relieve that feeling? And that's by taking that medication, that drug again, right? And more of it. Because when we build tolerance and dependence, that's the first dose that we took in the beginning is not going to be enough, right? It's not going to relieve those symptoms. And I think the most scary thing is that, with a lot of clients that I've worked with, is they've developed a dependence and they didn't realize that they could because it was a prescription, right? It was prescribed by my doctor, or this was prescribed to my son, my daughter, after their knee surgery, after their ankle. And people were not informed about it or not understanding the possible effects of it, that it can lead to a dependence and really understanding why, right? In that we have to understand the pros and cons that medications are helpful, but how they can also be harmful. And then also being aware of when that can happen and monitoring that closely, or knowing that it will happen, and then how to ensure to slowly taper off or titrate off the medication with care, right? Because like we said earlier, once you develop a dependence, your brain has now altered and changed to needing that. Okay. So short-term versus long-term effects. And I know I already touched on this earlier, with those commonly, prescribed medications for pain, for sleep, for anxiety, there's pain relief, right? When you take an oxycodone, if you take any of those medications, you're in pain, right? And so that medication will give you pain relief immediately, feel calmness, or have more energy, right? With the stimulants, with the ADHD medications, with Adderall, Ritalin. And then, in that instance, it really can make you feel better, make you feel happier, right? And so, like I said earlier, there's pros and cons, but the cons of the long-term use, oh, sorry about that. Long-term use is, yes, it can cause memory issues, mood instability. And the mood instability oftentimes is tied to either tolerance, right, and needing more, or when you're coming off. However, there are times when, because of the alteration in your brain chemistry, that people experience more depression and more anxiety because everybody's body can metabolize it differently, right? So while it can give you the immediate, maybe in the moment of the first week or two or months of the calm, of the pain relief, the after effect can be an increase of anxiety and depression. And so a lot of times people think, well, that's, how does that work? When the benzodiazepine was prescribed to me, I was taking Xanax to help with the anxiety, right? And now I have more anxiety. And it just goes back to how it affects your brain chemistry in that it's changing the neurotransmitters. And so now there's not enough of the Xanax, right? And the way that your receptors work, it kind of flips back. It almost, that term that people say, it just bites you in the butt, right? But, it helped. And then all of a sudden now it does not. It could definitely cause poor decision making. And because the misuse, the dependence, it just disrupts the natural balance, right? So our brain is now our body is using these medications and that's finding their new level, right? And so that's not the natural balance. And how do we make sure to bring it back there? And it's not easy to do it, right? It's kind of saying, oh, I've been feeding myself this, and you can't really abruptly stop because of the changes that have been happening in your brain. Even in that short time, right, of 4 to 8 weeks. Even in the first week, you can notice a change. That's why they're prescribed, right? To help with the pain, to help with that, to provide relief from the anxiety. And this is a very important question. Can the brain recover? Yes, absolutely it can, right? And then we have here, I'm saying with treatment, because it's very necessary. It's absolutely necessary that when individuals are stopping a drug, tapering off a drug, that they're monitored by um, meaning your doctor, whoever prescribed it, because there are certain things of how your body will respond, and they want to make sure that physically your body is okay, right? Because so recovery will and could and can include medical detox, so they can monitor your blood pressure, all the different levels, all the different things that can change in your body. Now it's so important because there's a physiological dependence. And when you're taking that away from your body, you're going to get really sick. You're just going to feel, I mean, I'm just going to feel overall really shitty, right? And then with therapy, because, when you're coming off of or you're detoxing from these type of medications, there's going to be a lot of emotions. We're going to feel things, think things about ourselves that really need somebody, professional help, somebody in the professional fields, right? As like a psychologist, a therapist, to really help process that. There's going to be things that you weren't feeling before because of the medication you were taking, right? The medication was helping with those emotions, and now all of a sudden the emotions are everywhere and coming from every which direction. And individuals don't generally have the coping skills in place, right? Because one of the coping skills was the medication, right? And now the medication has stopped working and actually causing more side effects, more problems than it was helping. Um, so having the medication support with that and the structured care. And that structured care means it can look like a lot of different things, right? It could be from detox, going into a residential facility, or going to a PHP or IOP. And that structured care, it's because it's making sure that there's always somebody 24/7, being able to monitor any changes in your thinking, any changes in your physical being, any fevers, sicknesses, illnesses. Um, and it just really, the amount of care that needs to go in, just shows that how delicate our brain is, right? And our brain can heal. It just needs time, accountability, and professional guidance, right? And it's not just, we really, really don't want anyone, just to stop cold turkey. And I know a lot of the doctors who are prescribing these medications, they will and they should be iterating over and over, don't stop taking it, right? Without any notice or without reaching out to them. But when people come to us, or by the time people are coming to me and looking for help, may it be with Desert Recovery Centers, with RTC, PHP, IOP, it's because they really need now that structured care, right? The recovery and the time to let your brain heal, because your brain can heal, your body can heal. That's the incredible thing about our bodies and our brains, is that we can heal, your brain can recover, but just needs time and accountability, right? With the doctors, covering every aspect for you. Okay. And so I don't know if there's any questions, any thoughts about the different medications. Um, Let me see here. Okay. Well, I just want to thank everyone for your time today. And if there's any questions, please feel free to call us. Our number is 1-888-291-8514 on our website. And you can reach us, look at our website, get more information at desertrecoverycenters.com. Thank you so much. Oh, I'm sorry. I do see a question here. The question is, how do I know if I'm starting to be dependent on prescription drugs? That's a great question. And this is when you know if you start kind of thinking about and waiting for the time. So I'm going to give an example. Let's say you're prescribed a medication that you need every 4 hours, every 4 to 6 hours. But if you're always constantly looking for it and wanting it, and on top of that, taking it sooner and taking more, right? And then there's the response to not having it. That's when you'll know that you're becoming more dependent. You'll probably start going to your doctor and asking for a higher dose. And now people have said to me, Dr. Nguyen, but what if it's because my pain has increased or I need that, I need more of it, right? And becoming dependent on the drug, just as long as you're staying aware of it and your doctor is, to see, do you need it? Or is it just that your body is wanting more, but is it necessary? Right? And so that is looking like more cravings, right? And thinking about and looking for it. And of course, trying to take the medication sooner and taking more than necessary, right? And that just means your body wants more, right? You're becoming dependent. And then if you don't have it, it is wreaking havoc in your daily life, right? And so that means you're seeking it out all day. And that just really describes the word of becoming dependent. It's seeking it out, looking for it earlier, wanting it. And when I say that to people, they'll say, well, I'm in pain. So yes, I'm thinking about it all day, right? And that is true, right? So two things can be true, right? You can't be thinking, but the dependency part is that you can't be without it. Um, and in a way where you start to abuse it and take more and outside of the amount that is prescribed, right? Because these prescription drugs are not meant to be the answer, right? So there should be other things in place to also be helping with the medication as you're taking it. Another question we have is, what can I do to prevent an addiction while taking prescription painkillers? That's a great question. So this is it's not a difficult question to ask, but it's one of those things is that, like I said earlier, the opiates, you can become dependent on it within 4 to 8 weeks, right? And so there's a caveat for that. That medication is and can make people be dependent upon it. That is the nature of that medication. They can't change that. And so that means anyone and everyone is susceptible because that is one of the characteristics of that medication, that your body becomes very much seeking it, wanting it, addicted to it. And so, how you can prevent an addiction is taking it as prescribed, right? And so, when your doctor says every 4 to 6 hours or every 6 hours, you really have to wait that every 6 hours, right? And then always checking in with the doctor if they increase it or about decreasing it, and knowing that there will be discomfort, right, in not taking it. And so you have to be very vigilant about that. And just knowing the truth about that medication is that it has an addictive nature. And so I need to take it as prescribed, right? And if I notice that I'm becoming more dependent, and if I'm always looking and I'm kind of abusing it, I took a little bit extra, I took more, or I'm now asking my doctor for more, that we have to kind of ask the doctor, let them know and be very honest about it so that they can either move you off that medication, uh, try something different. And also, when you're on painkillers, it's also great to also be involved in therapy at the same time so that you can be aware, right? So the prevention part is really just being aware and following the prescription as closely to the T, right? And not taking it more or less. But of course, when you're doing that, yes, you're going to have discomfort because it's not going to solve the pain, it's not going to solve the problem 100%. But a lot of times, because we have something readily available, that if I take this, the pain will go away right away. I'm going to do it at the 3 hour mark instead of the 6 hour mark. And that in and of itself can definitely lead to addiction, right? But in saying, well, I'm going to have to be in some pain. Instead of it taking away 100% of the pain, it's only going to take away 90 or 80 or 70% of it. And then we have other coping skills or other things that we've learned to kind of help bridge that gap. So, all right. Thank you so much. Any other questions? And if anything, I always tell people that always just try to be open with your doctor. Let them know from the beginning, like, I'm very concerned. This is what I know about this medication. I'm concerned about myself. I'm concerned about my son, my daughter, my dad, my uncle, my aunt, my husband, my wife taking this medication, and we want to be vigilant. So letting them know that as well. Or saying that, we want to try a different medication, right? And that's really kind of when the opioid epidemic started many years ago, was that there was not a lot of information out there, right? And now that there is, we can do and we can take medication or refuse medication with an informed decision, as opposed to just thinking, not knowing about the addictive nature of the medication. Because that's just a part of it, right? There's no way. That's why there's pros and cons to every medication. But I really believe that open communication, talking with your doctor, talking with your provider, letting them know your concerns right up front. And then also, of course, in therapy, expressing to them or talking it out with your therapist, to address concerns preventatively. Okay. And thank you so much and have a great rest of your day. Thank you for taking the time to join us today for our webinar.